Hola, ¿qué tal? Here I am, a slit lamp from northern Germany. The eye doctor who operates me, was planning another trip to attend a major ophthalmology congress. I was unhappy about having to stay behind. Nevertheless, I wanted him to talk about our everyday work. No one is interested in that. You, slit lamp, and I, we work in an ophthalmological practice in the countryside, and we are not specialists at all. But that is just it. We have known and followed our patients now for many years. So the novel way in which we document our strabismus patients is sure to interest them. But not all of them will be that interested in strabismus. Come on now, a slit lamp like me, all of them have one. Tell them that we are going to demonstrate skills of mine that they are unaware of. Ask them if they can believe that it was only you and I who took these images. Allow me to explain these things systematically. For my proper function, it is most important that the settings for observation and illumination are precisely adjusted. Since I was originally designed for examining the anterior eye, my observation optic's focal plane was set 10 centimeters in front of my objective lens. That makes me, your slit lamp, minus 10 diopters short-sighted. Tell your colleagues that all they need to do to get a binocular overview at about 50 centimeters distance is hold a minus 8 diopter lens in front of my objective. The patient needs to lean backwards before you take the videograph. Then we adjust the focus by moving our mobile exam chair. Additionally, we correct the focus by slightly changing the highly refractive lens distance from the objective. And thanks to its prismatic effect, we can position the image in the middle by moving the lens to the side. I can take such images with a slit lamp for oculoplasty. But I must of course say something about the special kind of illumination that is necessary to take strabismus images. The trick lies in using the slit light, which is what the patient fixates on, which for you, creates the Hirschberg reflex, and which finally illuminates the face too. You need to swing my illuminating column over and place it close to your line of observation. Since the beam paths are not exactly parallel, we correct for the small remaining angle with what we call a recentration prism. To simplify things for everyday strabismus exams, we've stuck a prism foil onto my diffuser. Slit lamp, now I want to say something about the role I have to play. Here you see a motility disorder in a 6-year-old girl. From individual video sequences, you pick out the best still images showing the typical squint position. They are often at the start and end of saccades of gaze. There are of course various ways of demonstrating our findings. Here the message is that the Beschreibung test is negative, typical of sursor adduction. At that point I briefly interrupted This child had surgery, and this is how you've known me so far. But aren't you much more interested in the result? We both find this image with the head turned and the central Hirschberg reflexes especially convincing. Here the Beschreibung inclination test is positive in the case of fourth nerve palsy on the left side. Continued. The more cooperative our patients are, the more strabological exams we can carry out. This we do to capture the characteristics of a specific disease in as few images as possible. We've developed special procedures for different developmental stages of a child and particular squint disorders. Of course, this does not replace strabismus diagnostics, but it provides you with easily understandable formats. Both your patients and their parents are often fascinated to see how their condition has changed. To get an even more precise picture of a condition with minor changes, it often helps to flicker through sequential videographs. You've spoken enough about us. Come home. Look, after all, you belong on my side. We've been working together such a long time.